Burton Eller is a strategic counselor to the agricultural community, where he has represented private, corporate, and trade association groups in their legislative and regulatory initiatives and advocacy efforts. He has a career-long involvement in the development of grassroots advocacy, taking the long view. He plays the long game, like me, of U.S. agricultural policy. Burton Eller has a deep passion for protecting the grassroots landowner and producer, and I'm all about that. So let's get right to Burton Eller. Burton, welcome.
Good morning.
Okay, let's get to the 340B program, and I want you to explain that and how this goes back to the individual consumer buying things at drugstores. Can you just walk us through what is actually happening here?
You bet, and it's not as simple as we might think it might be. It's gotten complicated in recent years. The 340B program is Washingtonese for a piece of the statute that Congress passed a law for in 1992 that's administered by the Department of Health and Human Services. It was set up to help healthcare safety facilities that serve large populations of uninsured, vulnerable, low-income, underserved patients to reduce their drug costs. It's funded not by government tax money, but by requiring the drug manufacturers to provide steep discounts on prescription drugs to these approved facilities. If a prescription costs $100 and they get it for $50, that the intent was to pass that savings along to increased access to the medicines and to the restricted drugs like cancer drugs, oncology drugs for the underserved patient. The thinking was that that should be simple. In recent years, particularly in the last 3 or 4 years, hospitals are using this savings to defray administrative costs and pad the bottom lines. It appears our coalition has done a lot of work that says Congress needs to kind of step in and take another look, and that's why we are talking so intently about the 340B.
Why should conservatives really take an interest in the 340B program? What does it mean for us?
Well, it's a program that is not being run as it was intended by Congress. Mm-hmm. It doesn't require government funding to help people. It's strictly a pass-through from drug manufacturers as required by Congress. We're not asking that government get into this. The Grange is a grassroots, non-partisan advocacy group for rural America, small-town America, and we're not advocating that the government get their hand in this to administer it differently. We were just asking for some oversight, and we want those savings passed back to the communities that they were intended for in the beginning. The folks that are really sick, they're uninsured, they're veterans, they're disability prone folks that need this help.
Okay, we're with J. Burton Eller. He's a strategic counselor to the agricultural community, where he's represented private, corporate, and trade association groups in their legislative and regulatory initiatives for some time. So if you're in rural America right now, let's say you're in Southwest Virginia, okay? We know that we've had people that are involved in this program that are not on the up and up, right? So let's take these bad actors who have taken advantage of the, again, 340B program. If I'm in rural Southwest Virginia or rural North Carolina, how has that hurt me?
You're probably not going to get your restricted drugs, the drugs that you need, as cheaply as it was intended. You may even be paying full price, plus you may have to drive 100 miles to get them, because consolidation is a huge problem for the 340B program. Hospitals are now a business, just like colleges. I just got through sending a daughter to college, and I'm discovering that most of these not-for-profits are now not-for-profit businesses that operate in the same way, and they have to stay in business. But hospitals are consolidating. This is driving up the cost because they are competing with the community pharmacies. They're competing with the local doctor. We particularly are hearing from local oncologists who say that in their private practice that this consolidation and further the contracting with the large drug store chains tend to drive many of their patients out of the market, that their prices are being charged at full price at the chain drugs,
right.
And they are being forced almost to sell out to the consolidated hospital that puts them under the wing of the hospital, and the hospital takes that savings, supposedly. There's a government accountability study, and Congress has looked into it a little, and there's some indication in the last 3 years that this is happening more and more and more. And this is in Southwest Virginia, the small hospitals are closing. They are being replaced by small clinics, and the larger hospitals are kind of like the corporate entity within the medical community.
Right.
Instead of driving 10 miles, 15 miles to your oncologist and then to the drugstore nearby, you're driving 100 miles. You're driving you're driving to Roanoke from Abingdon.
That's crazy. So let me ask you this, Burton. So we have all these large retail chain pharmacies now, right? Well, I mean, when I grew up, you had the corner pharmacy. That's gone. Now they're all chain pharmacies. There's only a handful of, I can only think offhand about 5 or 6 local pharmacies I even know in the state. I mean, they just don't exist. You got all these large retail chain pharmacies, whatever they are, Walgreens, CVS, Eckers, etc. And then, of course, you got all the pharmacies in Kroger, Farm Fresh, Food Line. Has the chain pharmacies made it easier for covered patients, or has it made it harder?
It's actually made it harder for
Why?
them to get the discounts and to get them where they need them, because instead of the local crossroads pharmacy that had this Coke counter, perhaps when you grew up in Blackstone,
right?
It's a chain now, and you may have to drive to Farmville to get that particular restricted drug, because these are drugs that people need for their cancer treatment, their worst case scenario diabetes treatment, etc. One issue is diversion. What the government accounting office found is that giving these medicines to people who aren't eligible, and even fully insured or wealthy people, and that's because they can charge full price for those drugs over the counter. Another is duplicate discounts. There's been some indication that some of these entities are charging full-price 340B drug program, but they're also getting a Medicaid rebate. And as we're having the debate over what to do about health care, we certainly don't need Medicaid paying twice.
I tell you what, it's another government program that has gone awry, right? I mean, just another one that's not managed. And people are making money that shouldn't be making money. The people that are supposed to benefit for the program aren't, right? I mean, isn't that the way you would sum this up?
That's the way it looks. Like I say, that from 2012 to now, the trend line on the statistics are pretty shocking. That these drugs are not going to the people that need them and at the price they're intended to be.
And so, who's pocketing the money?
Well, like I say, that the large hospital chains and large drugstore chains, every indication is that that's the only place it could be going.
Right. So instead of passing the discount on, and especially the people that can't pay it, they're making them pay it. And those that are not able to are not getting the discount either. So it just goes in the pocket of Big Pharma in some manner. All right, man, we're out of time. I really want to thank you for sharing this with us, trying to expose more government corruption out there. Thank you, J. Burton Eller. Hey, if people want more info on 340B, where do they go?
They can just jump right on a website, 340B, and it'll pop right up, and there'll be some phone numbers. And so it's a coalition of patient groups, of the pharmaceutical manufacturers, of doctor groups, and community pharmacists, etc. So just go 340B on Google, and it'll pop right up for you. 340B.
All right. Good job explaining that, Burton. I appreciate your reaching out to us and giving me and our listeners an opportunity to understand what 340B is and how they're getting screwed. Thank you so much.